When we started the company, the commitment was to fight cancer. And I think that commitment hasn't changed. In 15 years, the outcomes are so much better. Huge breakthroughs that exceed the expectations of what I thought was possible. But that said, 10 million people die a year of cancer. 10 million.
Amid the statistics and heartbreak, there are people who refuse to accept the status quo. For them, the expression curing cancer isn't just hyperbole. Such is the case for John Euler, who co-founded B1 Medicines in 2010 with a vision to bring a radically different approach to drug development. Instead of outsourcing costly trials, B1 runs them in-house, partners with community oncologists, and expands globally to make research faster, more inclusive, and affordable. As an analyst who's tracked cancer research for years, I wanted to understand how Euler, an MIT engineer, Stanford MBA, and former McKinsey consultant, landed in biotech, his chance meeting with co-founder Xiaodong Wang, and why success is measured in lives touched, more than 1.8 million patients and counting. I'll stumble over the questions.
Oh, no worries. I'll stumble over the answers.
John, thanks for sitting down with us.
Pleasure.
What inspired you to start B1 Medicines back in 2010?
I've always had a passion to be an entrepreneur since I was a little kid. I love science and I wanted to do something meaningful, but I wasn't really sure what as I grew up. Unfortunately, I went through a rough period in my life where I faced the loss of several people extremely close to me. And I decided I really want to dedicate my career to fighting for life and specifically fighting cancer. I had the good fortune of having a good friend, Xiaodong, who's a brilliant scientist and one of the youngest ever U.S. Academy of Science scientists. We decided to put the company together, try to build a really transformational organization that would fight cancer, but in fighting cancer, try to do that in a way that also is making medicine more affordable and more available to many more people here in the United States and all around the world.
How did the two of you connect?
I had this epiphany. I really wanted to be in biotech. I didn't have the perfect background, so I asked around, like, who are the best scientists that exist? And someone brought up, Xiaodong. And I went and asked to meet him, and he wasn't there. And I forgot about all of that. And 6 months later or so, this, young guy walks in and he's wearing tennis shoes and jeans. And he said, "I'm Xiaodong." And I didn't catch his name when he said it. And I had no idea who it was. About 5 minutes into the conversation, it dawns on me that it's Xiaodong, and we just totally hit it off. So at that moment, I thought if there's a way, in the future, we could do something together, that would just be spectacular. We chose B1 because B is symbolic of what every cancer patient wants. They just want to be here. The 1 has ONC in it, oncology, because we're fighting cancer every day. In the 1 is also the sense of we all need to work together as one to fight cancer. When we started the company, what was really different is we said the current system isn't working. It's just too expensive to make a medicine. I'm not from the industry, and I looked at it inside out and said, fundamentally, when you analyze this, 75 to 90% of the cost is all in clinical trials, which is incredible. My colleagues would all say it's $250,000 to $300,000 per patient in an oncology clinical trial to get one data point. For our major medicine, we've dosed thousands of patients. You can do that math. It's a multi-billion-dollar proposition to bring a medicine to market. The industry has largely outsourced this to third-party CROs, largely work in the same centers in the major cities in the wealthiest countries in the world, and that's where they're enrolling patients for clinical trials. When you look at this, it's the core competency of the industry, yet it's outsourced. And when you look at this system, It is very inefficient. It's manual double entry of data and then going back to send someone to verify if it matches. In today's world of technology, it doesn't make any sense. So from the beginning, we said we're going to be different. We're going to build this all in-house. We're going to have our own capabilities. We have to build a global team, and that global team has to work here with community oncologists, not just with the wealthiest centers. It has to work across the globe. We started in Australia and Korea and other places, more recently Brazil and South Africa. It has to open up clinical trial sites there, and that makes everything faster and more affordable. So when you do that, it doesn't just help your company on that one trial, it creates a broader clinical trial pool for the whole industry to use for cancer patients forever.
Today, B1 is solely focused on cancer. Why?
We spend about 10% of our research outside of cancer, but 90% is on cancer. And this is very important because recently a lot of money shifted from the major companies out of oncology, away from fighting cancer. But for us, there's a lot of patients, there's a lot of clinicians who are committed to fighting cancer. And I think we want to make it very clear. We're here, we're increasing what we're doing, we're not decreasing it.
How do you decide which treatments to chase and what treatments excite you the most?
So we're working in many major areas of focus. The first area in which we're a true leader is in hematology. And in that area, our medicine, Brukinsa, is approved in 5 indications. But one of the most important and broadest area of need is in CLL, which is a type of leukemia. In addition to that, in solid tumor, we're investing very heavily in breast cancer, in lung cancer, in gastrointestinal cancers, and also in HCC, which is liver cancer.
John, how do you create a global cohesive culture?
We absolutely try to be clear about what our mission is. And people really can be excited. It's fight cancer, and in that, get medicine to more people in whatever country you're in and all across the world. People love that, and they love it because sometimes they feel like maybe our industry has lost a little bit of that. When I recruit people, sometimes I say, what you have to understand is, you're coming from a bigger organization perhaps. That's like a cruise ship. You know where you're going, it's pretty luxurious, but you're getting off of that ship. And you're getting on to one of the explorer ships from years ago, and we think we can find a new world. We're trying to do things completely differently than anyone has before. And you kind of are going to get on the ship and you're going to realize everyone's rowing like crazy, believing there's a new world out there. And from one perspective, it's insane. But everyone has that belief here. And they really do. And they think it's worth that.
You've spoken passionately about breaking the cycle, about inequality of access to the most cutting-edge oncology treatments. What are some of the wins that B1's had in this area?
One metric by which we measure ourselves is how many patients are we able to get our cancer treatment to. And I think the number's over 1.8 million cancer patients so far. It's a truly remarkable number to have that impact. And it's just the beginning. It's really just the beginning for us, but we're proud of that. We can see that the hypothesis at the beginning, it's there. We can do things better, faster, less expensively, and it's not over. With technology now, because we have our own system, we don't have a third party between us, we can now apply technology much easier than if you're trying to apply technology, but there's someone sitting in the middle of it. You can't change their system. People worked incredibly hard so that we could be approved much more quickly in many more countries around the world. For example, Brukinsa was probably 60 plus countries.
Right.
And in some of these countries where we don't even have a commercial opportunity, we've worked through organizations like the Max Foundation to provide medicine from a charitable perspective there to really help patients even in these countries where you can't get medicine there.
What's your proudest achievement in building B1?
is when you hear that the company's helped a patient. That is very meaningful to me, for sure. I think as an entrepreneur and as a leader, I always said my best moment is when I lead a team and I say, we're going to do something that everyone thinks is impossible and they think I'm crazy, but then we do it. And in general, you get a few reactions. One reaction is, you've fundamentally changed the way I think about what's possible for the rest of my life. That's one reaction. The second reaction is, this is the hardest I ever worked, but it's the most rewarding professional experience I've ever had. It's still the same vision. It's the exact vision we started with, and it's working. Now lots of other companies watch the way we do things, and they're trying to change the way they do things. And I think that on the clinical side, this opening up a lot of centers, more centers all over the world that have global clinical trial experience, it's great for the whole industry. It's great for patients. This is the dream. You're doing something that is massively impactful. I'm super, super proud of that.